Hi, do you know how dangerous an aneurysmal subarachnoid hemorrhage, SAH, is? I will talk about this deadly disease and its treatment options. SAH is like a bomb exploding inside the head and spraying blood everywhere inside the skull. SAH is mostly due to the rupture of a blood vessel aneurysm in the brain, an artery that gradually increases and bursts one fine day. SAH is often a catastrophic event with high mortality and morbidity among survivors. Almost 20% of patients die from this bleed even before they reach the hospital. Those who survive this require immediate stabilization and transfer to a hospital with neurocritical, neurointerventional, or neurosurgical expertise. Patients with a ruptured aneurysm complain of a sudden onset, severe headache, typically described as the worst headache of my life, or a thunderclap headache. Once a ruptured aneurysm is identified, it needs to be secured as early as possible with either endovascular coiling or surgical clipping. Coiling or clipping the aneurysm is like providing first aid and securing the time bomb of an aneurysm. In endovascular coiling, small coils are taken up through a pinhole incision in the groin, and the aneurysm is packed and closed with coils, reducing the risk of further rupture. In surgical clipping, the surgeon opens the skull, retracts the brain, and places a clip across the neck of the aneurysm. Previously, surgical clipping was the only treatment available for aneurysmal rupture. Nowadays, endovascular coiling is the most preferred treatment worldwide for aneurysmal rupture as it avoids open surgery and can be done through a pinhole incision. Ideally, coiling or clipping should be performed as early as possible, preferably within 24 to 72 hours. However, even after this, patients may need to be in hospital for the next 3 to 4 weeks and face secondary complications including seizures, vasospasm, aneurysmal rebleed, hydrocephalus, water inside the brain, increased intracranial pressure, brain herniation, strokes, and others. Some patients need delayed surgical shunting. SAH is a deadly disease. If aneurysmal SAH is not treated immediately, it is like sitting on a ticking time bomb. And about 65% of those who survive the initial bleed die within 1 year. With appropriate and timely treatment, this can be reduced to around 18 to 20%. While early treatment can reduce the risk of death or disability, it is important to know that despite advances in treatment, aneurysmal rupture continues to be a devastating disease.